Okay. Dear students, let's continue again. Okay, another session of discussion on this past year questions in FMGE exam. So we are talking about pediatric question now. So question number 16. Bag and mask ventilation is contraindicated in the newborn resuscitation with clinical suspicion of what? Now this is a straightforward question, you know. I can easily write here the answer without looking at the option. This is congenital diaphragmatic hernia. Congenital diaphragmatic hernia as one of the most common contraindication for the bag and mask ventilation. You should know the reason here why it is contraindicated. Okay, we'll ask this question to most of the students, so please listen carefully. Now diaphragmatic hernia means the stomach and the intestine, they are present in the thoracic cavity. Now when we do bag and mask ventilation, a lot of the air will go to the GI tract. GI tract means it will go into the stomach and intestine, and this will inflate the stomach, and this stomach will compress. It will compress the lungs. It will compress the lungs, and lungs cannot inflate now. Okay, so if lung cannot be inflated, then that will lead to hypoxia. So your bag and mask ventilation will fail to improve the condition of the baby. So what you should do now, you should quickly identify this problem and then remove the mask. Okay, replace this with a tube, endotracheal tube. Connect this tube with the bag, okay, and then do the ventilation. If you do that, all the air which you are pressing will directly go to the lungs. The lung will inflate nicely and the baby will improve. So this is a very important question which will be repeatedly asked to you. Now other options are not the correct answer here. Okay, no need to even discuss those. Let's move on. Question number 17. Pathological jaundice criteria includes all except. Now this is except type of question, means 3 are true or 1 may be false, so we need to solve like that. So first let me tell you what is pathological jaundice. There are some criteria for pathological jaundice. So let me write those criteria here first. Pathological jaundice means if jaundice appear on the first day, it is always pathological. Okay, first day jaundice, it is pathological. Second, if the level of the TSB exceeds more than 15 milligram per deciliter any days of life, it is always pathological. When it crosses the palm and sole, not the crosses is not the correct word here. When it reaches the palm and sole, that word I want to say. When palms and soles become yellow, then also it is pathological. Another is when the rate of the rise is more than 0.5 milligram, or some of the book even mention 0.2 here. Okay, milligram per deciliter per hour, this is also pathological. And if the direct serum bilirubin, okay, direct serum bilirubin is more than 2 milligram per deciliter in any days of life, this is pathological. Another one, if it shows the problem of kernicterus or acute bilirubin encephalopathy. Okay, in the beginning it is always acute bilirubin encephalopathy, and later on it will develop kernicterus. This is also pathological. Now with this knowledge, let's look at the option here. Option A, 24 hours later but within 72 hours. This is not pathological, So this is false, isn't it? This is false for the pathological jaundice. More than 14-day persistent, this is true. I forgot to mention it here. If the jaundice persists for more than 14 days, it is always pathological. More than 2 milligram per deciliter conjugated bilirubin, this is also pathological. And clay colored stool is pathological because it is seen in obstructive jaundice. Okay, obstructive jaundice is always pathological. Now the correct answer is A here. because this is an except type of question. Like that you need to solve. Okay. Now let's go to question number 18. In neonate, which is the indication for chest compression? Very, very important question. Okay. So I just now told you, see here, if you do bag and mask ventilation, okay, if you do bag and mask ventilation properly, and even after doing it properly, if the heart rate of the baby is less than 60 per minute, then this is an indication for chest compression. Now with this, see here, what is the correct answer? Ambu bag ventilation for 30 seconds with heart rate 50. This is the answer here. So all others are wrong option. So you need to solve it like this. Okay. Question number 19. All of the following are signs of good attachment during the breastfeeding, except, now dear students, this attachment and positioning are the two questions which are very commonly asked, okay, in the breastfeeding, or from the topic of breastfeeding, position and attachment. Now this is easy question. Baby's mouth is wide open, okay, this is true. Baby's lower lip is everted, okay, this is also true. Lower areola is more visible than upper, this is false, okay. Upper areola should be more visible than the lower, and baby chin should touch the breast, this is true. So this is the except type of questions. So C is the answer here. Like that you need to solve, okay. But please remember one thing, attachment and positions are very common question which we love to ask in the exam. Now the last question from pediatrics for this session, which is the best parameter for acute severe malnutrition? If you remember, I already explained this in today's session. This is definitely, okay, weight for height. Weight for height, okay, because this is acute severe malnutrition, and weight for age is always for chronic malnutrition. This is for chronic malnutrition, and mid-arm circumference is actually, it is the screening method. This is the screening method of finding the malnourished child in the society. Okay. So this is not routinely done in the hospital, but we can do, of course, but in the society, this is one of the parameter by which we can collect the data, how much children are severely malnourished. And if it is less than 11.5 centimeter in less than 5-year age child, okay, 5-year-old child, then we know this child is having severe acute malnutrition. Okay, so this is also a very commonly asked question in the exam. So with this, let me end this session as well. We'll continue doing it. Thank you.